And all new this morning, we are introducing you to a group in Kansas City helping guide decisions of doctors and families across the world during the pandemic. It's the Center for Practical Bioethics.
And 41 Action News reporter Charlie Keegan is live for us this morning to tell us how this group makes a difference for you. Charlie, what role do they play in this decision-making process?
They have a very big role in multiple different aspects of healthcare, Taylor, and it's more than just doctors at hospitals who reach out to this group, the Center for Practical Bioethics. They actually work one-on-one with families and consult them on what's best for their family member who's inside a hospital, for example. Now, the center, though, doesn't make the decision for families, just gives them the information so they can make the best decision for their family as a whole. And, of course, you can imagine, since COVID-19 hit, the Center for Practical Bioethics has really ramped up its involvement in the medical profession. And they say beyond working with families, they also work with government agencies and help kind of establish guidelines for how to respond to a pandemic on such a large scale. They've also been pumping out different webinars and resources for doctors, nurses, social workers, those people on the front lines.
If we can make a difference for one person, one patient, one provider, and then if you multiply that by hundreds, all the better. But oftentimes, if it's just one, that's making a difference.
This group is making a difference for more than just one person, that's for sure. We know that some of their webinars have had more than 1,000 people watching at once, and the doctor you just heard from says that he has even, over the last 10 days, consulted with 10 different families or doctors on ethical issues, so they are very busy, as you could imagine, Lindsay and Taylor, right now.
Charlie, what about a vaccine? Obviously, we're all waiting on that to happen. They're playing a part in deciding what's going to happen with that, too.
They sure are, Taylor. This group really wants to make sure that a vaccine comes out in an equitable and fair way. They say historically, women and children are the first people to get a new vaccine when it hits the market. But with COVID-19, there's such an impact on the elderly. They're trying to answer the question if the elderly should now be the first people to get this vaccine when it becomes available. Still a lot of work to be done, though, to get to that answer.
All right, Charlie Keegan live for us this morning. Charlie, thank you very much.